I'm here with Sonia. We're going to be doing the question and answer part 2. First time it was with Callie, and this is Sonia, the other co-founder of Ketamine Clinic South Florida.
Hi, everybody.
Hi. Awesome. Let's get started, okay?
All right.
All right. How long do effects last, and what are they?
So during your infusion, I guess it's a double-ended question. So during your infusion, the infusions are 45 minutes. And usually most patients will be kind of in their, it looks like they're taking a nap, and they'll kind of be sleepy for about 15 to 20 minutes. And at that point, they will be able to, get up, use the restroom, and head home. You will be pretty calm and calm and collected for the rest of the day. Just very, I don't know how to say. Fuzzy, yeah. Pondering. You're kind of in that pondering state of what you just experienced, the thoughts that are going through your mind. So you really, after an infusion, always want to just plan your evening accordingly. You don't want to have like all your 6 kids running around where you have to feed them dinner. You really, plan on just being nice and relaxed for the rest of the evening. But then the very next day, you can go about your normal daily activities. Some people, depending on their infusion, may be a little, that they worked through a lot, which is what we look for. They may be a little bit sleepy and kind of find it hard to get out of bed the next day. But once you do so, you can proceed with your day as normal.
Cool. Thank you.
You're welcome.
Can you have a bad trip, and are there any lasting negative psychological effects?
All right. This is a beautiful question, actually, because I get asked this all the time. Now, when you refer to a bad trip, it is really, you want to look at it as when people experiment on the street, where it is done on your own with random dosing. You don't know what you're getting, how much you're getting, and you're really not necessarily prepared for that psychedelic experience. When you are in a ketamine infusion clinic, during your infusion, we are actually looking towards you going through an intense infusion. It's not necessarily a bad trip, right? It's something that has been bothering you, has been hurting you subconsciously for so long that when it's presenting to you, if you're on the street with no therapist or anybody around, that's a bad trip because you're not ready to experience that and work through that stuff. When you're in a clinic, when you have somebody like an integration coach to like work through it and it's presented to you, something that you have been battling, that's our goal, is to get that brought forward. And that's where ketamine infusions are so amazing, because it really allows you to separate your ego and see those events for what they are, so you don't have necessarily a bad trip. People wake up being like, wow, that was intense, right? They look forward to speaking with our integration coach, because that's where the healing occurs. We are looking for, not called a bad trip, we call it that transformational infusion.
Challenging.
Yes, challenging, intense, something that initially they don't want to see, but we always encourage it and just be open and accept it and just watch it and be there and experience it, because that's where the work is. That's where you need to work when that intense infusion experience occurs. So it's not something that's long acting. A lot of people, will work through with our ketamine integration coach. They'll talk to me a lot of times. We'll also encourage journaling to work through that experience as well. But that's when, at their next appointment, I see their eyes change. They have the life back in them. They just feel so free. So we're looking for that transformational experience. And by no means is it a bad trip at all. Okay, definitely not in a clinic where you have the support and the resources to guide you through that experience, because that's where the healing occurs.
Awesome. Can you do infusions if you are epileptic?
Yes, you can. We do have, there's a history where they like in anesthesia, we would try to avoid it, but as long as you're being maintained on your anti-epileptic medications, as long as everything is controlled, there is no contraindication. We may follow up and talk to your neurologist or your doctor that's managing your care to make sure and really see, when was the last seizure? Is it being managed appropriately? Do we have to adjust dosing? But it is not a contraindication.
Okay, awesome. I've struggled with severe PTSD as well as anxiety and depression for pretty much my whole life. I was wondering what it was like and if it was beneficial for you, because I'm super interested in trying it.
I'm so sorry you're suffering for that long. I really feel like ketamine infusions really allows you to kind of work through everything that you've been struggling with, because it takes away that emotional physical response. With ketamine infusions, I always describe as an anesthetic, it's great. It keeps your brain awake, it keeps your body awake, it just severs the connection. So you really have that out-of-body experience. You really have that infusion experience where you're able to experience the traumas, you're able to experience the memories, and just experience everything that's caused your suffering without the suffering. You're able to see those events occur as they occurred without the meaning that we created for ourselves. It allows you to be there without being there and without hurting and feeling it. You know, like going back onto the bad trips, a lot of people don't want to re-experience, or they get scared or worried. And initially during an infusion, when they start seeing or thinking of those thoughts, they may initially feel anxious, but with our training during the infusion, they know, okay, I'm just watching it. And once they do that, all of a sudden everything melts away and their body is just there, but they're just watching, you know, like a little movie, and they're just seeing it very objectively without emotion. And that's a lot of where the healing occurs. So I definitely recommend with PTSD, with lots of traumas, to really be able to work through all that.
Yeah, definitely. I feel like also when you are, undergoing these infusions, you might, experience and see trauma that you didn't even know was still sitting inside you until it pops up and you're like, wow. Hey, so I was curious what they do ketamine infusions for.
All right, so ketamine, traditionally an anesthetic, we use all the time in the hospitals providing anesthesia. For ketamine infusions here in our office, we treat all mental health disorders, treatment-resistant depression, also other mood disorders, anxiety, PTSD. We even have fibromyalgia and migraines. Actually, we have quite a few patients that traditionally migraines, we do a higher pain infusion dose, but I have mental health infusion patients that actually have been completely relieved of all their migraines, when they suffered them daily. And so migraines, even on the lower doses, has been treated very, very well with ketamine. Fibromyalgia, I believe, OCD, though it is a little bit more difficult with OCD, it is treated, managed with the ketamine infusions as well. And of course, chronic pain infusions.
What is fibromyalgia? If you want to
Fibromyalgia is a very difficult disease where patients have burning sensations, have pain. It's almost like extra nerve pathways in your digits in your body, so you're very sensitive to temperature changes, and sometimes you just have burning in your fingers or burning in certain areas of your body, almost similar to a chronic pain, regional pain syndrome, which is almost unbearable pain to live through. But with fibromyalgia, it's just a constant nagging, aching, burning, hot, exhaustion throughout. Yeah, it's a very difficult to treat. It's hard to treat. It's hard to diagnose and treat.
So the easy part is the referral, but I have Crohn's. Does that have any effect?
So with Crohn's, there are so many different aspects of the cause of Crohn's. A lot of it really is genetic. Some of it's diet. A lot of it can be mental health and stress and trauma. Growing up, there's so much. Everybody's grown up differently. How we grew up with our diets and how we were born. Were we born in a stressful environment? Were our mothers super stressed when they were pregnant with us? All of that can affect our outlook. So I have some patients that do suffer from Crohn's, and they've actually found their symptoms have improved somewhat. There are different instances or different management approaches, so every patient is different, and it depends on the extent of the Crohn's, because Crohn's does cause hardening and narrowing of your intestinal tract. So depending on the extent of the Crohn's, if you're still at just that inflammation stage and the irritation, then it's something that ketamine can help, because it can help with anti-inflammatory responses in the body. And that's where we see a lot of the benefit in the brain and in all of the body, just because ketamine is such a great anti-inflammatory.
Cool. What if you need a higher dose to start because you've had a lot of ketamine in your life? So I guess we'll just assume this is black market ketamine, if you want to answer accordingly.
So assuming that it's black market, we would kind of like dive deeper in, because we wouldn't want you currently taking ketamine on the street and then try to give you ketamine IV. We do drug test our patients, so we do want to make sure you don't have any ketamine in your system before we start, because obviously that's a red flag. But therapeutically, of course, we will adjust the dosing, depending on how long it's been since you've used ketamine. Because we have had patients that when they were younger, they used ketamine on the street, and it actually would help their mood, so they were using it, and it was just kind of one of those things. It's bigger on the West Coast, but here it's not as popular, though I have heard of it being used here on the streets as well. So we will adjust based on your dosing. We will start off low initially, just because that's just the standard. We want to see how you feel. It's a first introduction, because while you can do it on the streets, it's very different therapeutically done in an IV at a dose. Because you may have done it on the streets, but how much were you actually getting? What were you getting? Was it just ketamine, or was it other drugs? So those are very many factors that play into that. So each patient's different, but yes, we will adjust dosing based on needs for patients.
Awesome. So is the goal of clinics is to get people to disassociate for a period of time, and ideally work out connections with trauma? We use it at work in emergency settings, so this is really cool. So do you?
Oh, yes, I do. Yes. Well, thank you for your service, because I know it's tough to be in that field, so you're definitely mentally strong. With ketamine, we do have, on the field, right? I'm assuming maybe a paramedic or ER doctor or anything, where we use ketamine to really dissociate, and pretty much the purpose of it, right, is to separate your mind from your body, so they stop moving, right? They relax, they calm down, they go into their dissociative state, so they're not present and aware of everything that's going around them that they can't mentally handle at that point. And that's what we're looking for in infusion therapy, right? So obviously we don't start off at that high dose, because I know on the fields they're doing high dose IV push or IM dosing, which is intramuscular in the muscle. Our infusions are over 45 minutes. So while maybe some patients may get a dose that they would get in the ER or on the field, emergently IV push or right into the muscle, ours are maybe the same dose, but it's over 45 minutes, right? So it's really you looking and dissociating from your body, and in essence having an awake dream into your subconscious mind, I like to say, because when you're having the infusion, you're actually separating yourself from your ego, right? You're actually starting to have this dream on things where you're seeing events or people or things happen without your ego getting in the way. The stories that you tell yourself, or let's say you see this traumatic event that happened that told you that I'm a horrible, disgusting person, I'm stupid, I'm not good enough, I'm not all these things that have hurt you throughout this life, and allows you to separate it and see the event for what it is, and then allow you to let go of all that other stuff, because that event occurred, happened, and went away, right? But those stories stick to us, and that's where the infusions really allow you to become aware of it, and then really then that's where you're able to acknowledge it and then work from there, because until you know it, where do you start from?
Awesome, good one. I tried ketamine once by accident, and my experience was horrible. How is this different?
Very different. All right. First of all, how did you receive it? How much did you receive?
What was it?
What was it exactly?
Actually.
And you weren't properly prepared. It was done on accident. Ketamine and any other psychedelic is very therapeutic. It's very healing if you have the right support and you have the right preparation. It's very important to have an intention when you're going into this space, because you're going into your subconscious mind. It's going to tell you things, and you want to know what your outcome and your goal is going to be.
Yeah.
When you're given it it's given to you accidentally, you're not mentally prepared, right? When I give anesthesia and I give ketamine high dose, if that's going to be my only anesthetic, I'm also giving another sedative that takes away your memory and like makes you not remember what you're seeing subconsciously, because you're not mentally prepared to get thrown into your subconscious mind out of nowhere. People will freak out, and they used to freak out in hospitals until we started sedating them appropriately, right? Because you have to be properly coached and ready to go into that space, right? Doing it accidentally on the street is not a safe space, and it's not in any way where you prepared for seeing what you saw, you know.
Of course, and that's why the experience was horrible.
That would be a bad trip.
Yeah.
Like what we discussed earlier.
Yes. Hey, so this ketamine therapy, does it really help? Does it get you super messed up?
Nice. I'm glad you changed that word. Messed up. Okay. So it does work. It is so
beautiful.
It is beautiful. You know, I grew up with close family members that struggled mentally, and it was very defeating and hopeless, and a lot of my stories came out from me not being able to help them, right? I'm not good enough, I'm not smart enough, you know, how could I be in this space? But through these infusions, you're really able to work through everything that you're struggling from subconsciously. It allows you to just separate all those stories and all these meanings that you gave for something. You know, when people do things that hurt you, 99% of the time it has nothing to do with you. They're in their own world, in their own reality of what's going on in their life, and you happen to be a consequence, but they didn't do it intentionally to hurt you, right? And pretty much that's what ketamine infusion therapy allows you to do, is go into an infusion, let go of all the meanings and the stories you've created about yourself and others, and really see your life for what it is, and see the meaning for your life and everyone else. Because in essence, you are actually, it's a transcending experience, a connecting experience, and very healing in that space.
Yeah, and to touch on that, you know, the reason why we have 6 infusions is because each time we give you a little bit to prep you, and then a little bit more, and then a little bit more, depending on how your body's tolerating it. And so to answer the question of, you know, does it get you super messed up? I mean, I wouldn't say messed up, but you definitely, towards the end on your higher doses, you definitely have that disassociation effect. But we prep you for that. And that's why, instead of just one and done, you have 6. So,
yeah. And it's not that it messes you up. It's like, in essence, you're having an awake dream.
Yeah.
So for us, during an infusion, when we're monitoring you, it looks like you're taking a nap.
Yeah.
But behind your eye shields, under your blanket, and your noise-canceling headphones, you are having the most beautiful dream. And as the doses get higher, at some point you'll have an intense dream where the real work happens. And then after that, all of your infusions are beautiful and peaceful. So it's really, it's weird to say messed up. It's just more of like, it takes you a little bit longer to get up to go to the bathroom as the doses go up. So
love it.
Yeah.
Love it. Awesome. Can I try this treatment while deployed?
It's difficult while being deployed, because it depends on if you're having the infusions, if there's a clinic overseas. So depending on where you're deployed, if you can find a place. And then I'm not sure as far as the rules for, you know, being in service, because you would test positive for PCP. You know, you would test positive for ketamine. So is it, if it's something that you are referred and you're going to a clinic and it's medically administered and all that, what they would accept. So that's something that you would have to talk to your healthcare provider in the military to see if that's even allowed. Because I know, for example, you know, the whole world now pretty much allows medical marijuana, but in the medical field, it is still not allowed. Like, we do not allow, even, I actually, a few years back, had a nurse in the OR who got fired. She was having medical marijuana, but because it was in her system, it didn't matter that she had a card and was licensed to be administered and prescribed it. She was still fired because of the medical practice. So, or her nursing license board or whatever it is. So definitely reach out to your
I guess
office
officer.
or your officer in charge, or a
Psychiatrist.
doctor, psychiatrist, yeah. But it's definitely very beneficial for military, definitely.
Jinx. Okay, where can I learn more about ketamine treatment?
Okay, well, definitely check out our YouTube channel. The links below. Also, you can check out our website, ketamineclinicsouthflorida.com. There is a lot of resources there. You can also contact us there or email us also below, and we can actually send you some research articles. There's so much research being done, and now you can actually probably Google it or YouTube and find a lot of videos. Just be careful of the sources. There's some people who did infusions without the proper integration or the proper dosing or the proper supervision, and they may or may not have had bad experiences. So I would take everybody's reviews, or experiences with a grain of salt, just because they could be different. It's very important at the clinic that you attend, the dosing that you receive, the integration that you receive, where you'll have that, the healing experience, or what you'll get out of each infusion.
Yeah. Another black market question. How is this compared to doing it on the street? I know you literally touched on this earlier.
So doing it on the street is difficult to answer because I don't really have experience, so I'm not sure the effects of it, but I also know how much ketamine are you receiving? How are you receiving it? Is it mixed with other medications? And are you getting the right dose? Sometimes people get too low of dose, sometimes people get too high of a dose, they're thrown into a K-hole, have a horrible bad trip, and are traumatized, or they're getting a low dose, or they're getting another drug. Now we're finding that fentanyl is getting laced in other medications, so now you're at risk of, death, because fentanyl, or the carfentanil from China, that's deadly, so there's no comparison actually at all. I can't even see, possibly those that would inject it, but even then, how do you know what you're getting? Are you getting integration? Do you know how to really work through the things that you see? And now we have another phone call. Recording. Okay, so now we're starting again with the question about the ketamine. There is no comparison with ketamine on the street to ketamine infusion therapy, just because of the lack of integration. What medication are you actually receiving? Is it laced with other drugs? And do you have integration? So you don't know the dose that you're getting. Is it therapeutic? You don't know the drug that you're getting, what's actually in there, and you don't have the right integration and preparation to actually receive the experience in a therapeutic manner. So I would definitely discourage people from doing it on the street thinking that it is going to be a therapeutic experience for them, because there's so many factors in making ketamine an actual therapeutic intervention for your mental health.
Awesome. Do you do mushroom microdosing at your clinic?
Well, first of all, mushrooms are still illegal in the United States of America unless you want to join a church in Utah. So there are so many studies being done for psilocybin. It is very healing and very therapeutic, but it is still not legal. In the future, once it is, that is something that we would definitely implement. But it's very different when you say microdosing, because microdosing is something that's a very low dose, something similar to like a antidepressant that you would take every morning, or during certain events that you want to open up or just be less anxious, or certain different things that you're suffering from. Microdosing is something like that, because you're not getting a psychedelic experience. You're getting more of an antidepressant, anti-anxiety, anti-anything effect, right? In a clinic setting, it would always be macrodosing, which would be a high dose psychedelic experience, because that's really where the in-depth work becomes, or
breakthrough
is, exactly. So right now, people to get those experiences will need to travel out of the country to receive that. So you definitely want to do your research as far as where you can do those retreats, and that you have the right integration coaches there with you, or they're also known as shamans, to really guide your experience, to make it therapeutic and not have a bad trip, as most people say. But so it's very important that you actually have the right dosing, the right space. They call it ceremonies, for that essence. But yes, in the future, we do hope to bring on, different psychedelic therapies, perhaps the psychedelic assisted psychotherapy with MDMA, psilocybin, and as well as ketamine. So those are all in the works in the future in the next 3 to 5 years, once those pass all the testing.
Awesome. Can I do this treatment for my MDD?
Yes, actually. For those of you who don't know what MDD is, major depressive disorder, there's treatment-resistant depression, which is TRD, for those that have attempted multiple medications and it's failed, per diagnosis that you've had to have tried 2 medications that have failed. So in major depressive disorder, that is actually one of the big things that we do treat with ketamine infusion therapy, along with PTSD and anxiety and all the other diagnoses that we discussed. But it is definitely therapeutic, because you really do want to get to that root cause. With normal antidepressants, it's definitely they do help people, right? When people are struggling, antidepressants are there for you. But it's a band-aid to what you're experiencing, right? So you have major depressive disorder, you have a chemical imbalance. They give you this pill to treat the chemical imbalance. But really, is that the cause of the depression, right? One of the first things that I always ask patients when they say, I've been struggling from depression for 20 years, 10 years, 15 years, 16 years. My first question is, what happened 20 years ago? What happened 10 years ago? There's things that happen in life that cause chronic stress, messes up all of, your cortisol levels go through the roof. Your hormones, are you eating right? Your diet, what's your sleep? There's so many factors that can affect your depression and any diagnosis, really. And we really need to get to the root cause of that. It's not just taking an antidepressant and rebalancing everything and then taking away every history that you've ever had. No, we need to work through that history. And some of it's deep down and below, buried deep inside. You thought you worked through it, but during that infusion therapy, it's going to come right out if it's not healed, right? Yeah. It's going to be brought to the forefront.
I think a lot of the experiences that we go through, it shapes our personality, and it creates a judgment in our mind, and these scales of this is better than that, and I prefer this over that. That's all created by the experiences of your lives, because obviously you weren't born with any of that. So one negative experience that happened to you 20 years ago, it's sticking with you, like up until you walk in this office. It's still there, just because you don't see it every day. So yeah, definitely crazy stuff. So I'm assuming, obviously, you've done ketamine infusions yourself.
Yes.
How has ketamine changed your life?
Ketamine infusions really taught me how connected we all are and how our energies are all combined. And I really found that I've found my purpose and my passion in this life. We first opened the clinic during COVID, and it was difficult and it was stressful. Both Callie and I are working in the hospitals, being bombarded with COVID and dealing with that aspect, but then also trying to heal others here in this clinic. So it was really difficult mentally. And during the infusions, I questioned a lot of it. What is my purpose? Am I following the right path? Am I supposed to be doing this? Am I just fighting the inevitable that I shouldn't be doing this? And during the infusions, it just shot out of me in a glowing energy, and I knew that this was my path and that I needed to do whatever was necessary to keep going and helping others. And during the infusions, I would think of different patients, and I would think of my personal life and my family and everyone in the clinic, and I just felt so much love and unity, and it changed my life in knowing that this is my purpose 100%. And I love coming here every day, and I love talking to all my patients, and I just love helping people. And I get to help someone that has tried so many other options and is still struggling and is like hopeless, And so, yeah, that's how it's changed my life.
Oh, God,
So, yeah, That's me. How's it changed your life?
As you're like
distraction.
I would say, well, I feel like you did your infusions like a while back before I did, so I feel like you've had a lot more time to process, like years of processing, compared to me. I just did mine in February. I will say that one thing that sticks out to me is how it's changed my life. I would say my infusions kind of told me that I'm capable of doing anything. At one of them, I was on stage at a TED Talk where, a couple of years ago, I expressed an idea to someone in my life at the time, and they were like, "No, you could never do that." And then I was on a TED Talk as a speaker in my infusion, so it was kind of like that something that someone had told me years ago was what I didn't even remember. It just was still there, and it was like my mind saying, "We know that this is still here brewing in the back of your mind, and we're going to put you on stage and show you that, physically you're not there yet in reality, but you can do anything. I can be on stage. I can be, a pro snowboarder." Probably not, but, it's just...
You want us to, it's all practice.
Yeah, it just kind of gives you that confident boost, and in that, when I was that TED speaker, everyone in the audience was people that I knew, and through all the different areas I've lived, so it was just a huge abundance of love and like empowerment. And so I didn't even think, I didn't even ever have that thought or image in my head of me being on stage actually doing a TED Talk, but because it was in my infusion, it almost makes it more, like real.
Possible,
yeah, because it's like something that I didn't even remember that was brought to my attention by the back of my mind. And the whole point of this process is when you sit down in the chair, you just trust that your mind is going to show you what it wants to show you for like your best interest. So apparently my mind wanted me to get on stage at the TED Talk. So stay tuned for that.
Yeah, there's a lot of people that will come into the infusions expecting this intense, transformational, hard infusion. And sometimes patients don't have that, but that's not necessarily what they need. And the infusions show them what their mind is telling them, right? Subconsciously. So it's really just how you're feeling at home. About 90% of them do have that intense experience, but some of them don't, and that's okay. Your mind is going to show you what it wants to show you, and as long as you're getting your ideal dose, it's going to be there.
It's a beautiful thing.
It sure is. All right. Other side questions, because I know you've lived in different places. You're from Boston and California, so somebody was asking if it's available in Boston.
And then LA, right?
And LA, yeah. Places in California.
Yeah. So, I have gotten asked this question a bunch from friends in Boston, a lot of friends in Boston actually, and California. I will have to tell you to wait for this answer because I want to go through clinics in both of these areas with Sonia, and kind of just look at their website, look at their protocol, because we hold such a high standard here. I don't want to just Google search clinics in Boston and send you wherever. I want to do some research. I take about 2 weeks, 3 weeks, but I want to go through them with Sonia, and then together we will find the best suited clinics, relatively close to our morals and our ideas and the way we think is the best way to go about this therapy. Yeah, because
essentially, there are clinics out there, and essentially we are providing infusions, right? We aren't licensed therapists in-house, right? But are the providers in-house? Do you have an anesthesia provider in-house? Is there a CRNA that will be there to support if necessary? Are there nurses? Are there techs? What are the protocols? How high dosing? All right, so while we are creating the list, there are ways that you can research yourself to see if you find the right clinic. When calling the offices, are you speaking to a live person? Are they knowledgeable about ketamine? and most will be. You do want to ask if there's an anesthesia provider in house. If there's a CRNA like myself, or nurse anesthesiologists, those offices tend to feel more comfortable going higher doses if needed, whereas those that don't have anesthesia providers in house will kind of stick to lower dosing. So depending on your needs, that may be a limiting factor for you. You also want to make sure that you feel comfortable. Do they provide integration coaching or different therapies? Because it's important for you to be able to work through what you experience, right? When you come into a clinic for ketamine infusion therapy, yes, you're receiving the infusion. It would be amazing if that's all you needed to do and everything else was done and you went back to normal life and didn't have to do any other intervention. But there's work to be done. So are you going to be guided through journaling, through coaching, through the things that you really need to do to transform your life to make the ketamine last longer? If you're implementing things that we teach during our infusion series, the ketamine can be lifelong treatment, where it lasts forever if you implement the other things that we teach you. A lot of patients in the long run will need maintenance infusions. I know that's not part of the question, but you may need maintenance infusions every 4 to 6 weeks. Sometimes we have patients every 8 weeks, and it really depends on the diagnosis. And then they monitor themselves to see when it's needed as the mood and the depression or the different diagnoses start to progress, and they'll feel it and they'll reach out. And we always follow up with our patients as well to see how they're doing and if boosters are needed. But a lot of them don't need it. If you implement the things that you need to implement and make the changes that you need to change in your life with the discoveries that came out for you during the infusions, ketamine is going to last a long time. So if you have the right clinic, that's very important because you want to feel comfortable where you are. You want to feel safe and cared for, and you don't want to be pushed in and out, right? There's no rushing. Mm-hmm. So it's important that you have that experience.
All right. Well, thank you so much, Sonia, for answering all of our questions. You are amazing. Thank you, guys. Like I said in the last video, do not hesitate to blow up our DMs, email, call us. Send us as many questions as you'd like, and if we didn't answer your question on this video or the last one, send us a message. We'll get it answered for you without a doubt. And yeah.
All right. Thank you for all your questions.
Yes.